For people with diabetes, it's important for them to check their feet every single day for their overall health and prevention of added foot problems. Joining me now is Dana Manusco of the Wound Center at GBMC. Welcome.
Thank you.
So talk a little bit more about this. Why is it so important for people with diabetes to check out their feet daily?
So people with diabetes have two problems primarily. One is that over time they develop neuropathy is what we call it, which means some people start with numbness, tingling, to absolute loss of protective sensation of their feet. And so what tends to happen is that they'll have a pair of shoes that don't properly fit, and they'll end up with a blister on their foot because they can't feel the shoe rubbing on their foot properly.
Okay.
And so that develops into a wound, and again, they don't feel that happening, so that's why they need to inspect their feet and make sure that they don't have a wound.
So what are some of the symptoms of diabetic feet? Is it just the wound, or is it swollen? Can you sort of describe what it is?
Yeah, so again, people with diabetes and who have diabetic foot ulcers typically start with, again, like the pins and needles type sensations, turning into complete loss of sensation. So also cracked, dry skin is a problem for a lot of diabetics, especially around the heel areas, which, you know, if your skin is dry and cracked, it tends to open up, and then you can get bacteria and infections.
Well, that's what I was going to ask you, the complications that come with it. What are those complications, and then when do we know when we should see a doctor? Is it really just on the onset of something seeming amiss?
So it's not like when you were a kid, you fall off your bike, you scrape your knee, it scabs up, it's not a big deal. With a diabetic foot ulcer, there's so many other processes going on in your body that it's so much harder to heal that wound. And so I would suggest if you have a wound on your foot and it hasn't made any progress in 2 weeks, or if you have a wound on your foot that hasn't healed completely in 4 weeks, it's time to see a doctor.
It can be scary. I'm sure someone is watching and knows a loved one that might have this ailment right now, or might be looking down and noticing that on themselves. What are the treatment options if they need to get this checked out?
So typically when we see patients in our wound center, there's a whole host of treatment options available. Number one, we want to look at the tissue in that wound. Is it healthy tissue? Is there dead or necrotic tissue in the wound bed that needs to be removed? Typically what happens is the podiatrist would scrape away some of that necrotic or dead tissue to reveal a healthy wound bed. That's number one. Number two is getting rid of any callus formation around that wound that's causing pressure in that area. And number three is inflammation and infection. You want to make sure that there isn't an active infection in that wound. Like I said, diabetes with elevated blood glucose levels, you're more susceptible to having an infection. So managing that infection, maybe you'll be referred to an infectious disease doctor if it's something that's active. Sometimes the infection can reach the bones in your foot, which is really terrible, because then you're at risk for amputation, limb loss, and all other things.
This is not something you want to ignore and just think like, oh, it's just a sore, it's going to go away. You really need to get this checked out. Before we even get to that point, though, there are preventative measures that people with diabetes can take, correct?
Yes, absolutely. Yes, so it's super important for anybody with diabetes to, like we talked about earlier, inspect your feet daily. Make sure that you're getting down there, looking at the bottoms of your feet. If you can't reach the bottoms of your feet, get a mirror, put it on the floor, you know, like look at the underside of your feet. Sometimes people don't notice they have a wound until they notice even blood in their bed sheets or something. Oh, what is this? You know, and oh my goodness, I have a wound on my foot I didn't know about. I think also just taking care of yourself too. People don't always realize the impact your mental health has on your healing. And so just doing those things and seeking help when you need to.
And with GBMC, you have a Lunch and Learn series and Wound Wednesdays. Can you talk about those?
Yes, Wound Wednesdays. Okay, so the first Wednesday of every month is when we have our Lunch and Learn. It's an educational series. We talk about different modules in wound healing, how to help your wounds heal, how to exercise with your wounds, how to manage your diet, and how diet really impacts the healing of the wounds. The next one coming up, I believe, is May 1st. And it's going to be all about diabetic foot care. We're going to have one of our podiatrists there to talk and just educate our patients about how important it is to take care of your feet. And it's also a nice forum for patients, you know, for people going through a similar situation.
They're not alone.
Exactly.
And they can ask the questions that they're afraid
Yes.
about. Now they're getting the answers from the professionals at GBMC.
Exactly.
Thank you so much for being here. Really appreciate it.
Yeah, it was a pleasure being
And
here.
for more information and to register for Wound Wednesday's Lunch and Learn, you can go online to that information that was just on your screen. We'll be right back with more Midday Maryland right after this. Stay tuned.